okay? That meant that people in hospitals were rushing around trying to discharge people quickly so that they didn't, cost the hospital more than the hospital was going to get paid to take care of them. I know of an HMO that went broke because of one person that I saw in my internship. She was a heavy smoker, okay? She vomited and tore her esophagus loose from her stomach. The stomach stuff went into her chest, and she was dying when I saw her in the emergency room, the last patient of my internship. She would have gotten better and gone home, except they couldn't get her off of the ventilator because she was such a heavy smoker. Millions of dollars. Okay, in 1992, the resource-based relative value scale went in with Medicare and Medicaid. And it's been used, I believe, by other companies. This was a way of skewing payment so that specialists would be paid relatively less than primary care physicians. Now, primary care physicians have residencies of 3 years. Specialists, a neurosurgeon might take 10 years, okay? In the meantime, that guy's not really earning very much money. But if you need a neurosurgeon, you can't go to a family practice guy. You need a neurosurgeon. That's who you need. And if a neurosurgeon is, if a medical student or resident is going to be paid more for being a primary care doctor than a specialist, guess what he's going to do? Rather than spend 7 years, or even more, out on the hustings, up all night with sick people, that's why there's a shortage of specialists. It's just basic economics, and it's the iron laws of human nature. Not Hillary, not Obama, none of these people. There's not one single person of any persuasion whatsoever who has yet managed to fix the mistakes that God made in a human being. Okay? They're there for all eternity. Alrighty. Now we also have the Independent Payment Advisory Board. Okay, the board's independent, all right. Nobody can rein them in. It's 15 unelected people. They are there to decide what things will be covered under Obamacare. And if it's too expensive, what's one less person on the face of the earth to them? It's not their mother, not their brother, not their husband. So at this point, Beth was right. A car, you can get insurance for a car. Right now, people who are forced into Part A of Medicare and people on Medicaid, they've actually had a pretty good run because they vote. But at this point, we are becoming like livestock on a government ranch. Now, livestock are taken good care of course. I mean, they get antibiotics and they get food, and they got a barn to sleep in and so forth. But at some point they get on a truck and they never come back. Okay? Now, why would it be the government's business, your medical care? Why would it be? It's not a proper function of government, right? It never was before, and it still really isn't. But it's a good vote-buying scheme. Anytime the government says we'll give you something, run in the opposite direction. Because sooner or later, it's going to collapse. And we're at that point now. I was going to be a veterinarian. I love dogs, had dogs all my life. But veterinary medical schools, I never applied. They, hung crepe everywhere. Everyone did. Oh, you didn't grow up on a farm or a ranch. I guess they think you'd never be able to take care of a goat or a cow. And that might be true of a lot of people. People can be scarier, but veterinarians, they have no absurd coding, no long pleading phone calls to companies for pre-authorization, no crap about specific words in the chart. It was a long time before I learned that a specific word in the chart could change the code. I was in an emergency room doctor. You know, very, it was not the kind of emergency room that people walk in with a little nothing. It was the kind where people come in and they're dying. They're shot, they're stabbed, they're raped, they're, you know, et cetera, et cetera. Well, if you use specific words like septic or something like that, the people coding that, and we weren't the ones that did it, can code it differently. So what happened with the patients all being on Medicare, Medicaid and or Medicare, if they were 65 or older, was the hospital went broke and closed, or I'd probably still be there, you know. We got a letter, hospital's gonna close, you know, can't go on this way, losing money. So the hospital went closed and broke. Okay, you don't deal with resource-based relative value units. You don't wait 7 months to be paid. I have a dead check from Medicare for over $700. They wouldn't give me a new one, but it came in, I mean, months after I saw the people. There's no incomprehensible explanation of medical benefits. As somebody like me, I don't consider myself a genius, but if I can't figure it out, I mean, what about the poor person, you know, that's on the other end of the line, you know, the patient? I had one patient, okay, I got something from Medicare. This is just a little horror story. It's a letter from Medicare. It says, you saw so-and-so in August, and our records indicate that he died in June. If this date of death is not correct, what is the correct date of death? And you did this code, this code, this code. So I said, well, I can't predict the future on the date of death. I said he was alive when I saw him in August. So I called the guy up, and I said, Mr. So-and-so, I said, have I been treating a ghost? And he says, oh, he says, it's not funny. He says, you know, they deleted 3 months of Social Security from my bank account, and my checks are bouncing all over town. Okay. So if you're on Medicare, good luck. You're probably doing okay still. It's been a nightmare for doctors. There was no explanation, you know, about Medicare in medical school, or I might have run the opposite direction. I've seen it all, ladies and gentlemen. I hope that we can institute some creative methods for medical care in the United States of America. There are Christian Care Medishare companies, Samaritan Ministries International, Christus Medicus. There are doctors that don't take Medicare, so that you can go to them if Medicare won't let you have something, which Medicare has been gradually retrenching, but the doctor is holding the bag saying, oh, no, Mr. So-and-so, we can't do that for you. They should be the ones explaining Nancy Pelosi, Barack Obama. There's the Oklahoma Surgical Center in Tulsa, Oklahoma. Their prices are posted on the internet. They will do certain types of surgery. They're expanding. They don't do everything, but they do a lot. There's MediBid. If you need something or want something, you can go on the internet, pay $25, and put down what you need, and a doctor, you know, may say, okay, I'll do it for you for X amount of money. This is happening. These creative methods of medical care are happening all over the nation, and some people are going to Thailand and India to get medical care, believe it or not. That may happen. So, you know, if you have any questions, I'll entertain them. Yes?
I've been hearing a lot about seeking medical treatment in Costa Rica if it's not made available to us here.
Right.
Do you have an opinion about that?
It's a nice country with you know, free market in medical care and with well-trained people. I mean, we've trained a lot of these people.
Right.
I mean, I've had colleagues from all over the world. Yes?
Do you know if enrollment in medical schools has gone down considerably, or do you not know the statistics?
I don't have the statistics at my fingertips right now, but a cardiologist that I know well, who is on the faculty at Washington University, tells me that the quality of the medical students and residents has dropped significantly.
What do you think that's, why?
Because smart people are not going to go to medical school anymore. I mean, they're just not going to. There are people quitting surgical residencies, you know, because they see what's ahead of them. Yes?
When does the full impact of this hit? Because I understand the insurance company that insures me said they were grandfathered in because they made no changes. Once the changes are made, then they're going to be,
Then they're
we're gonna get hit with a price increase.
right. And, you know, nobody knows exactly when that will be. I mean, one problem is there's incredible uncertainty in the United States of America over medical care. And, you know, I often discussed with my patients that uncertainty is one of the most wearing things for us as human beings to deal with. Medical uncertainty. I mean, people would say to me things like, such and such couldn't happen, could it? Unfortunately, I had to say, yeah, it could. And if you don't think that something bad can happen like that, then think of those buildings that fell in an hour. Nobody would have predicted it. Yes?
Could you give us some idea of a scenario of how Obamacare is going to collapse because the young people aren't going to pay in?
Well, if there's nobody to pay the bills for the other people, then there's kind of a, they call it a death spiral. The money's just not there. Okay, if they can bamboozle the young people who don't need to buy these big plans into parting with their money for them, you know, they're going to be a lot better off. But I think, I mean, I'd like to push it off over the cliff myself. It's so unworkable. I mean, the medical chart, for example, is supposed to be a method for one doctor to communicate with another, and also so that a doctor can look back and refresh the memory on what was done for the patient when things happen. Now it's for bean counters. Where do you start? I mean, the pages of the electronic medical record are a maze of teensy-weensy little icons that nobody knows what they mean, you know. And if you know, click on something, you don't know what's going to happen. Anything could happen. You know, people. I saw somebody one time. This was just a few years ago. And she was a lady, about 35 years old, and her, you know, the part of her record that was supposed to be the past medical history had all this stuff in it: diabetes, HIV positive, and so on. And so I said, to myself, yeah. I said, so are you HIV positive? She says, no. And somebody had written there in teensy weensy, I mean, like 1 millimeter typeface, pertinent negatives. And it was like a nurse practitioner wrote down this list of pertinent negative. Well, it was junk information that I didn't need. Going to the medical record now is like going into a hardware store that a tornado's just gone through. It's awful. Be sure you know what the case is with you. You know, don't say, I'm taking a white pill. Know what the name of the medicine is and what it's for. Yes?
I just want to let everybody know, I got supplemental insurance and paying for the nose for it. And I was having my eyes done, and I made it purpose because I'm limited income, I'm on Social Security, so I called up and got a quote from the a place where I was getting my eyes done, and they quoted me, and even the two agents that sold me my policy told me it only cost me $45, maybe $75 at the most, for both my eyes to be done. After I got all said and done, they went ahead and they went and sent me a bill for like $250, and then the supplemental that I had that's supposed to be all so good, wouldn't pay some of it, most of it. So all that they tell you, even if you are honest and upfront and ask them how much it's gonna cost you right down the, and within reason, how much it's gonna cost me, they'll lie to you.
I could not walk into Barnes Hospital and say, how much is an echocardiogram gonna cost? They would not tell me, because it depends. Oh, what kind of insurance do you have? What kind of lobbying
Well,
did
they
you
had all
try?
that information, that was the thing.
Well, God only knows. What?
Couple of things. We talk about the system collapsing, but we do face the possibility of single payer. You know, and if the young people don't join and it doesn't turn out the way they at first envisioned it, how can we prevent the federal government from just taking it over?
Get out in the streets. And I'm ready to do it. I grew up in Washington, D.C. I saw all these people with the Vietnam War. And if, Sue Harto or Sukarno, whoever that guy was in Indonesia, when they finally really got sick of him, he was gone in 2 weeks.
If you remember the summer of 2010, we were on the streets. And we worked very, very hard to try to prevent this. But Harry Reid changed the rules. And the thing originated in the Senate, which was, and if it's a revenue bill, as Justice Roberts said, it's a taxes. That always has to originate in the House.
That's right, in the Association of American Physicians and Surgeons, we sued Obama just days after the
Right.
thing went through, and that's one of our, the origination clause.
Right.
Exactly.
But it seems like the Constitution just doesn't matter anymore, for
But,
any reason.
okay, you have to bind them down with the chains of the Constitution and never give up. And it may well take people out in the streets, just
Right.
gumming up Washington completely.
Okay, I have another section. It's not Obamacare, but it's what's happening here in Florida with the amendment for medical marijuana. We all know that was backed by Morgan & Morgan, and the purpose of it is to get the young people out to vote for Charlie Crist, who has already backed it. Now, I have heard that there are prescriptions that contain the same substance that is in marijuana, that there's no need to smoke a joint, that you can get that substance from medical prescription. Do you know anything about that?
I don't know much about that. The stuff is tetrahydrocannabinol.
I couldn't pronounce it.
Right. It could certainly be purified, but,
What are the medical properties of it that wouldn't do any good?
it helps people who are taking cancer chemotherapy, their appetite is better, they can eat.
Stops nausea.
Yeah, right.
It's also,
Yes?
they're utilizing it for glaucoma,
Yeah.
things like that.
But, certainly that could be purified and used. The mistake was in having the Controlled Substances Act to begin with, because now there's all this pent-up desire to use these things. Believe me, I've seen it all with drugs. I actually have never had anybody in the emergency room just for marijuana, because it tends to make people just kind of dumb, I think. They just spaz out. Whereas cocaine and heroin and all that kind of stuff, they're hopped up. Yes?
When Obamacare is fully implemented, which I hope it never is, even when we still have private insurance, what they're gonna call private insurance, are the insurance companies gonna be regulated to the point where they are not gonna make the ultimate decision, or I have had the same insurance for 18 years, and next year I'm gonna lose it. Even though I was seriously ill 2 years ago and got the best of care right across the street here. I had 4 specialists, no questions were ever asked, I got who I wanted. Are those days coming to an end?
They could be because, you know, the government has a monopoly on force, and they are the ones that regulate the insurance companies.
The other question is, when did this, when I've had private insurance through employers for 40 years, when did we go from a point where I went to see a doctor and no insurance company was ever involved? Where did that change? Was that sometime in the 80s or why? Was that Medicare that spurred that, or the government, or union insurance, or because I never had an insurance company ever pay a doctor when I was young. You paid them yourself, and you had insurance if you got catastrophically ill.
Exactly.
And that was through my union when I first started working. Nobody ever went to it. Every doctor ever asked you about insurance. back
No,
then.
no.
You paid your $40 or $25 for the office visit. That was
Well,
it.
those things that happened starting in 1929, that changed insurance. The HMOs and the employer-sponsored plans. Your employer doesn't really care if you live or die. I mean, those employer-sponsored plans set up a headbutt between employers and employees. The employees didn't care how much anything costed because someone else is paying, and the employers didn't want to give people medical care because it was costing them money. So, but it changed gradually, you know, starting in the middle of the last century. And now all we ever hear is, you know, what's your insurance? And there's loads of people, you know, in the uninsured, they get medical care, believe me. There's the Emergency Medical Treatment and Active Labor Act that says that any time somebody goes to a hospital and they need something, the hospital has to take care of them, has to stabilize them at least. There's no emergency legal act, okay? No. You know, there was a guy that killed one of his wives up in Sarasota, and he was from Germany. And when the prosecutor said he would seek the death penalty, all these lawyers came out of the woodwork because Germany was going to pay him. Then when he said, no, I guess not, they all melted into the woodwork. Instructive, yes?
Yeah, would you say the best way going down the road now to avoid this whole governmental control would be the concierge doctors?
Yes, that's certainly one thing. First of all, don't ever sign up for Obamacare. Don't go on the website. Stay away from the government. If you can, find a doctor that's not in Medicare. It can be tough to get out. I was out for a while. Now I'm back in, unfortunately. Go to places that aren't in Medicare, you know, and go to Medibid and things like that.